Well, I think we can get started. It's 4 minutes after 12. I think we can get started.
Wonderful. All right, great. Well, thank you all for being here. And one of our missions throughout this crisis and even moving forward, one of our thought processes has been, let's accelerate, not decelerate as a company, and understand the pain points of the industry, or industries around both athletics, and even the senior health space. And one of the biggest topics I know that virtually everybody on this call knows of and has heard of is telehealth. And so we're really excited to have an incredible panel today speaking and alluding to some of the different challenges in telehealth, some of the insights that they have as telehealth experts, and how we can all work together moving forward to look at telehealth as a potential solution, not just, again, today in this crisis, but as we move forward into the future, how can it add real value to the marketplace? And so we're excited to have you all here. Thank you for being on this call. I'm going to give a quick intro. We have a really esteemed panel of panelists, starting with Tony Zhang. Tony is the president and CEO of Blue Jay Health, a rapidly growing telehealth company, and have a lot of, he has an enormous amount of experience and has been a HIPAA compliant platform now for several years. And it was on the forefront of telehealth. Rafael Salazar, who's an occupational therapist by trade, but also a healthcare consultant and a professor. We have him with us today, so we're excited to have Rafi. Rafi's going to lead a lot of the discussion and conversation. Daniel Seidler, president of TelePT Solutions, and also a consultant around healthcare, but a telehealth expert. So we're excited to have Daniel. Thank you for being here, Daniel. And then Dr. Eric DeYoung. Eric is a national director for Motion PT. He was responsible for bringing telehealth into their organization about 18 months ago, and has seen a significant transition from very little usage of telehealth to now a fully blown, successful telehealth platform. So that's exciting to have him here. He's a doctor of naturopathy as well as an OT. And so we're excited to have this esteemed panel. Again, thank you for all being here. I hope this adds a ton of value to the discussion around telehealth. I know it will. But at this point, I'm going to turn it over to Rafi. And Rafi, maybe you can start off the conversation, give it a little definition around telehealth, which is such a broad term, as we all know. And then maybe go into some of the key topics we want to discuss with the team.
Yeah, thank you very much, Barry. So I think prior to March, there were talkings of telehealth, and it's been one of those things in the background of healthcare for a very, very long time. I know when I was at the VA running an outpatient clinic there, we had done some initiatives in telehealth, but it had never taken off, and it had never taken kind of the forefront as when everybody had to stay home, right? And then we had to start finding a way to touch people and get in their homes and keep providing services. But when you talk about telehealth, the term itself is very, very broad. I mean, it can cover everything from remote monitoring of vitals and compliance with medication, all the way to in-clinic or virtual service delivery. So I'm going to toss the first question over to Daniel here, since he does this kind of work a lot. When we're talking about telehealth for physical rehabilitation, for sports medicine, even for elderly patients, what do we mean when we say telehealth?
Thanks, Rafi, and it's great to be here today. Well, by telehealth, obviously it's communication with patients by, in this case, video communication, audio-video communication. There are, I think we all know, there's several ways to do that. Remote patient monitoring is keeping track with digital products. You can do store and forward, which is basically patient recording something that they do, pass it back to the PT, and it's asynchronous, meaning it's not happening in a live situation. They send their information to the PT. The PT can then respond to them at their leisure. And most of what telehealth is at this point, though, is synchronous audio video. So a physical therapist or a practitioner connects with a patient in a live video chat, and there's an actual interaction, an actual encounter, an actual assessment or treatment that occurs. And the objective is to really achieve something similar to what happens in an office. And I say this all the time to people, this is not about, telehealth, physical therapy, occupational therapy, and any other encounter or intervention is not about just reviewing some information, reviewing home exercise programs. It's an intervention. It's an actual treatment.
Yeah. Yeah. And Eric, you run this program for Motion PT. How does a telehealth session or telehealth mode of treatment work for your organization? How have you implemented it?
So interesting question, Rafi. This has been an evolutionary period. Dan and I actually worked together at Motion PT, and back in April 2019, Dan actually launched the initial version of telehealth within Motion, and then I was able to expand it. We did it as a strategic, methodical rollout across a large organization across multi-states, and then March and the pandemic hit. It became a very urgent need to launch telehealth across the entire organization, and it was a lot of long hours, a lot of heavy lifting, a lot of virtual calls, a lot of emails, a lot of troubleshooting. We partnered with Blue Jay and Tony Zhang and his team that's on this call, had a lot of interventions with practitioners to help them overcome their fear and their discomfort with. As a practitioner myself, I like to have hands-on. I like to be with my patients. I like to have that one-on-one face-to-face, and to try to help convince practitioners with years of experience that this is a new way we have to treat our patients was difficult for many. But it's an emerging practice principle, and it's been around for several years. It just became a very spotlighted issue. And there's still complexities with it. There's still connectivities issues. There's still reimbursement issues. There's still the comfort zone issues. There's still the manual therapists who are struggling with, how do I connect with my patient through a video conference opportunity, but how do I give them the manual therapy treatments? And so these things we're still solving for, but I think the essence of being a clinician is that we emerge and that we adapt and that we become innovative and that we figure out a way to overcome and provide therapeutic opportunity. And I would agree with what Dan just said. This should be a very skillful intervention that mimics the relationship, the professional relationship and the skill set level of the practitioners, just in a unique environment. And we're still learning, Rafi. We're still learning every day.
Yeah. Well, and I think I've mentioned to a couple of you before, like the opportunity that I see telehealth providing anyways, is it kind of allows us to still participate and still provide that high value, high impact stuff to our clients. Tony, as far as, we're rolling this telehealth out, maybe somebody's just now wanting to do it in their clinic. From a technological standpoint or from a tech stack, what is needed from a platform, integrations, that sort of thing?
Yeah, thank you, Rafi. I agree with Eric that we are at the very early stage of implementing telehealth, especially for therapies, for rehab. And I was fortunate enough to work with both Daniel and Eric in Motion PT, and really try to navigate this complex system, how to implement telehealth. That was way before COVID-19. That was way before that we see any light in reimbursement, but we thought that's the way the future could be. And so it's a long way till now, and we still have a lot of hurdles, as Eric just mentioned. The connectivity issue. Not every patient has the the bandwidth to deal with a good video signal, and reimbursement issues. Every state is different. Every commercial payer is different. So I believe we'll go into that topic later in this talk. But in my mind, telehealth is more than just a communication platform, a communication between a provider and patient remotely. It is care delivery, as Dan alluded earlier, that during this telehealth, you really want to treat patients. You really want to assess patients. So just a Zoom call without a good record keeping is not enough. Without a patient-centered appointment system is not enough. So a real telehealth platform, ideally, is that first, it has to be HIPAA compliant. It's a secured system. And second, it has to be centered around patients. Patient initiate the request, or the therapist or admin people, help to make appointment. All those arrangement has to be in place, and patient gets reminded, and they log in at the right time. Maybe there's intake questions, and during the call, instead of a video communication, how do you assess patients? How do you assess patients' range of motions? How about strength? How about, all your protocols in the clinics? Can you move it to online? And after the session, how do we handle the records? Do you have good report that you can export and do the billing? And all that different aspects of care delivery is critical for a telehealth platform. And on top of this, Dan mentioned asynchronous. And when between these sessions, between patients' visits, how do you engage them? How do you know they receive your treatment and adhere to your program, like home exercise program and so on? So all those asynchronous communications like secure messaging and managing patients' adherence and outcomes becomes part of a larger definition of telehealth. So that's in my mind different aspects of telehealth.
Okay. Yeah, there's a lot of pieces there. From, let's just say somebody wants to start up tomorrow. I'm going to put telehealth in my program. Maybe Daniel, you can talk to this too. What do you need? Obviously, you need some kind of computer, some kind of web-based application. Talk to us a little bit about what the clinician needs, and then what maybe the client or the patient would need in that kind of scenario.
Sure. I mean, I think a lot of people have discovered that in its simplest form, all you need is a phone on either end, right?
Yeah.
That and a FaceTime, basically. All right. But that's not telehealth the way it's really going to be. That's not setting anybody up for success in the long run. And I know a lot of practices have used that as their solution, at least in the short term. Good Band-Aid for the first couple of weeks, but you really have to be thinking about how telehealth is going to fit into your practice. And there's a lot more to it. So first of all, most important, a safe HIPAA compliant platform that ensures connectivity easy on both ends, right? The practitioner and the patient needs to be able to connect very easily, and be sure that connectivity is going to be is reliable. And it's going to, one of the most frustrating things for practitioner and patient is a technological glitch, right? Yeah. If this call were to just fall apart right now and have a technological problem, which I was on a Zoom call recently, that happened. And it's frustrating. You kind of decide, do I want to go back on or not? Do I want to resume this or not? And if that happens multiple times in a call, then it's over, for the patient. It's very frustrating. And PTs are dealing with the technology on a daily basis, and they're not techno wizards, they're not the IT team. So you have to have that easy connection. It has to be very reliable. It's also important that if you're a practice with more than one person, you have to have some sort of policy and procedure about how you're going to do things. You have to have understand your workflows and understand the responsibilities for the admin staff, the practitioner, and how it's going to go and how that's going to blend into your everyday practice as well. So, I mean, I could go on and on, but that's really the basics of where you start. Have your processes in place, have your technology in place. I mean, the technology is as straightforward as a reliable internet connection on either side, right? A phone or a computer with a microphone and camera. And there are challenges associated with all of that. There's always patients who have their camera blocked, or they have their microphone set to not work with certain applications. And PTs are getting, I keep saying PTs, but practitioners in general are learning what the common errors are, what the common glitches are. I mean, we all kind of learned on the fly, or at least a lot of people had to learn on the fly and understand how to deal with most scenarios. Scenarios. I think we've all gotten better at that.
Well, and I think we've been talking about around it for a little bit, but the main emphasis for moving into tele has been the COVID-19 pandemic. So Eric, from a standpoint of your organization, and you started telehealth before this happened, how has the COVID thing, the pandemic, affected telehealth where you're at? And maybe from there, we'll talk about where we can see it going into the future.
Yeah, absolutely. So I'll give you a couple of quick examples. And before that, I just want to capitalize on what Dan was talking about. Telehealth is an emerging practice. And yes, you can find the simple Band-Aid approach with the quick Zoom call or the quick FaceTime. We have to caution ourselves as licensed professionals to not dilute the clinical significance of this virtual platform. We need to keep it professional. We need to keep it regulated. And we need to make sure that it's a high standard expectation of practitioners to deliver the best level of care under their license. So I'll leave it at that. So the complexities are there for that too. For Motion PT as a primary retail forward-facing outpatient therapy organization, we were in the same unique situation as all the other top players in the physical therapy outpatient space, OT and PT included, in that we had to solve for our patients not being able to come to our clinics because of the shutdowns, because of social distancing, because of the fear of viral contamination, because of curfews, for a variety of reasons. And even today, we have some social issues going on in our communities where patients still can't get to us, and we don't need to minimize the value of our healthcare services. If we are truly essential, then we'll find a platform to be able to deliver that care and that quality, and to be able to keep clinicians, practitioners, physicians, patients connected. And there's a variety of those tools that are out there. Uniquely for me, I'm in the senior care space within Motion as well, that I had been involved with prior to the telehealth initiation. And for me, we're in the most significant, most fragile population from a pandemic perspective. Our average
highest
age,
risk, basically.
highest risk, right? So we're at 88 years of age as an average population. We have several thousand residents in our senior living community spaces across multiple states and markets, therapists that need to go to work to go into those spaces. There's a high risk potential for us that we have to watch the CDC guidelines and protect. And we were shut out of a community early on in which the community was fearful of a fragile population. So physicians couldn't go in, nurses couldn't go in, external vendors weren't allowed in, home health partners weren't allowed in, family members weren't allowed in, and residents weren't allowed out. But physiologically, our physiology doesn't shift because of a pandemic. This population needs mobility, needs musculoskeletal strength and stability. Risk of falls are still a significant issue. Social isolation is still an issue. Sarcopenia is still an issue. And if these folks are not receiving those critical care services that are essential, what's going to happen to them and where are they going to go? Well, fall risk is a problem. During a pandemic, they can't fall with a broken hip and go to an emergency room and go to a hospital. For a lot of reasons, they don't need to be there. They also didn't need to go to a nursing home, right? We saw the outcome of some of those issues, right? So I actually went to Trazer, who I know is sponsoring this call, and said, look, I need to solve for this. I got a Trazer technology in my clinical space I'm renting inside of a senior community. My therapist can't go. Residents still need care. Can we connect telehealth services to a technology rehab platform and still be able to integrate therapy services? And so this has been an interesting evolution in our practice model, and a significant need to remain relevant in a population that's critically at risk.
Yeah. Well, that kind of leads us into another question we might have wanted to talk about later, but we can talk about it now. Barry, from a tech standpoint and interfacing with telehealth and patients receiving telehealth from, maybe a physical therapist or an occupational therapist or even an athletic trainer, how does a tool or a technology like Trazer kind of approach telehealth? And then how do you see it implementing in your business model, or how do you see it adding value to like a PT practice?
No, it's a fantastic question, Rafi. And I apologize for everybody in the call. I put a suit on today just for all the esteemed panelists and the rest of the callers on here. And unfortunately, I don't have any video. So I wasted I could have worn my shorts and a t-shirt. I appreciate the question, Rafi. And to Eric's point, Eric hit the nail on the head. Like I said earlier on in this conversation, we were looking at this time period. We said we need to accelerate, not decelerate as a company, and take the blinders off that a lot of us get when we're in the day-to-day grind, and look at our clients' pain points. Look at our Trazer families, and we call everybody Trazer family because they are part of the family's pain points. And Eric was really the first, or Dr. DeYoung was really the first to bring some insight to the table early on in this this crisis that we're all dealing with. in regards to the telehealth solution. Of course, we knew of telehealth. We are giant believers in a connected platform. Connected is a much broader term in our minds than telehealth is, but maybe the first step being telehealth. And how do we provide that solution through our existing platform that's very proprietary and innovative, that provides incredible modalities, at least we believe they do, to our client base and our physical therapy groups, our athletic groups, our senior health groups. But how do we connect people when they need to be connected? And telehealth is really that solution, Rafi. And again, Eric gave us the initial insight. We've done a lot of work with Tony on the call in regards to this and the integration of telehealth. But for us, it's looking at the ability to connect people and connect clinicians with their patients in a way that wasn't able to be done before. And what we're looking at now is, what does the future look like moving forward? To I think one of your next points, Rafi, is what does the future look like? I know a lot of the statistics and the numbers prior to the crisis. Telehealth was very underutilized, in my opinion. During the crisis, you've seen a huge spike, for good reason, in the telehealth adoption. Now, what's the balance going to be like moving forward? And for us, we believe that telehealth will be a staple and should be. But does that negate the clinician that provides incredible value to the rest of, to their patient base? Absolutely not. But there is a balance there. So what is that balance going to look like moving forward? We're big believers in the technology. We've integrated it, or in the midst of integrating it now for that very reason, because we are huge believers in the value and the promise it has for everybody, from the clinician, the organization, the patient, and even the payers. But there's a lot of logistical concerns, I think, a lot of reimbursement concerns. And again, what does it look like moving forward from a balance standpoint? Regardless, we believe as a company that's going to have huge value, and it's certainly something that we want to have as an integral piece of our platform.
Yeah, thanks for that. And you kind of pointed to it. We all jumped into telehealth, or everybody, the whole world jumped into telehealth because of COVID. But at some point, COVID will be done, hopefully, right? We won't be sheltering in place for long or much longer, which begs the question, what happens to our practice? How does COVID change our practice in the future? Part of that is going to be telehealth. And I know, Daniel, you and I talked about it, all the possibilities that are out there for integrating telehealth in a practice after this and outside of COVID. Can you talk a little bit about just kind of what telehealth looks like post-COVID?
Well, it's been, I've been on several panels and other webinars and all kinds of chats about this subject. And for 2 months or so, I've been telling people that they really should be planning for 20% of their practice to be remote. Interestingly enough, I attended a web education program yesterday with some of the experts and other thought leaders in the field. And one of them was saying, we really should be thinking about 30% or more.
Wow.
And the reality is that what's happening right now is both sides, practitioners and patients, are understanding the value of telehealth and accessibility, convenience, and all these things without the loss of quality in most cases, right? So you're still getting the same kind of outcomes, which the PT/OT space is doing lots of research, right? I mean, this moment is going to be magnified in a big way on research on what kind of outcomes happen here. But I anticipate that in most cases, in the overall outcomes are going to be pretty close to in office, and maybe even better because accessibility is higher, right? So the way I see it is that most practices are going to have a significant component, and practices that are surviving, I'm talking about surviving and thriving, they're going to need to have a significant component of remote care. Patients are going to demand it. Payers will pay for it, and the practice will also thrive and find efficiencies and ways of delivering better care, more effective care, more consistent care by using remote telehealth care.
Hey, Rafi, real quickly, would you mind if I just asked the group a quick question?
Sure.
I'm curious about, because Danny, you brought up some really interesting points, and one of my core questions, even for us, is moving forward. And Tony, maybe this is something you could jump in on, or Daniel, or Eric, or Rafi for that matter. But how do we objectively quantify? Because again, the remote components are great, but where does is the engagement there from your all's perspective? How do we objectively quantify outcomes appropriately when somebody is remote without the hands-on attention of a therapist? Do you guys see the solutions there, and do you see ways to quantify objective outcomes that ultimately are going to lead to better success with the patient, the clinician, the organization, as well as the payer, and all these stakeholders that are engaged in this process?
How about Tony? You have something from a technology perspective?
Yeah, from technology perspective, there are, I think we will see a lot of specialty, in-depth special use cases which demands special protocols and technologies for rehab care to be delivered online. Some general things like range of motions. How do you measure range of motions? And Bluejay has developed the AI technology that is online when people are doing the movement, and we can assess people's range of motions by recognizing the different joints in the body, in the image, and automatically give out the number. It's still beta phase, but that's one of the solutions. Then there's how do you measure strength? How do you deliver care and that people, without you doing the demonstration, the demo, and let people follow some sort of video guidance to do movements and try exercises. How about muscle contractions? Can you measure them? And so in the end, I think it all depends on the specific use cases. And I think range of motion is a big thing, and other protocols, assessment protocols, has to be adopted online. And we are working with a number of academic leaders in the field to develop such protocols. And so even different areas of therapy is different. If you're a therapist in a skilled nursing facility, then that's something, you probably want to supervise your PTAs, go room to room, and without directly interact with the patient, maybe carrying an iPad. And if, for that matter, home health, home care, it's similar. But if you are an athletic facility or a senior care facility, you probably want to consider a technology like Trazers with telehealth, with technology in training, and with a central location for people to come and seek the training and consultation. So, and we see workers' comp area, they have their protocols of generating reports on the outcomes. So I think there are a lot of innovations to be done in various verticals of therapy and rehab. Technology-wise, you will see a lot of new technologies coming up just for rehab and therapy, telehealth. So that's exciting. It's an exciting time.
So as far as outcomes go, Barry, in answer to your question, I think the answer is threefold. One, I know a lot of several practices, several of my clients are keeping very close track of their outcomes, same way that they were measuring outcomes before, using devices like photo and other outcome measures, measuring devices, right? So that's one thing. I know that the PPS, private practice section of the APTA, has their initiative, and they will be requesting data from practices for this time period, right? They have an initiative going already. And of course, insurance companies, payers, they're definitely tracking what's going on right now. They're watching this closer than anybody, because they want to figure out ways to capitalize on the efficiencies of what we're creating here, in addition to ensuring that they are getting the outcomes, right? And I'll throw it back to you, Barry, because my hunch is that a system like Trazer is ideal for tracking outcomes, and I know you already do that. How do you see that integrating with telehealth? or this moment and measuring what's going on?
No, that's a fantastic question, and yeah, we have a very unique and versatile platform, and for those that don't know the breadth and depth of Trazer, we look at everything from balance very sensitively and specifically in regards to quantifying sway and potentially air measurements for certain balance related tests, to kinematics, looking at joint angles and such, and squats and single leg squats, etc., to dynamic movement using simulation to track, reaction times and lower extremity function, to neuromechanics, which is really a giant push for us. But for us, ultimately, to be a truly effective platform, we can do it with an organization, to Tony's point today, very well. And we can integrate that telehealth component and allow those seniors that are isolated today to be able to communicate with, Dr. DeYoung's physical therapist remotely. And I think get enormous value out of that. In the future for us, it's the innovation around the agnostic aspects of our technology, so that we can drop our software on any platform. So it's no longer constrained by a actual hardware component for Trazer, for example, but it be dropped onto your phone or your iPad or your Android. It doesn't matter. It can be dropped onto virtually any platform. And you have this connectivity. You have that ability to use it remotely, but also still track and quantify outcome measures around those key modalities that are so vital within these different populations that we're speaking to. So I think, it's a deep question, Daniel. It's a fantastic one. The reality is telehealth is a great solution. It's a great solution for us, and I believe our clients today. But the future is really awesome. And that's what we get incredibly excited about, is that vision, and working with guys like yourself and Tony and Raf and Dr. DeYoung. That's what's really, really exciting about what the future can look like from a connected standpoint that goes, again, above and beyond just telehealth, but connecting all stakeholders, users or patients, clinicians, organizations, and payers. And I keep referring back to that because I think that is a sort of a missing link within healthcare today, is that connectivity. And I believe that that's the direction that we're going in. And I believe telehealth is, again, a major component of that, and a substantial part of our vision for moving forward is that connectivity. But again, there's other components. There's the agnostic aspects, like I said, of the software onto any hardware platform that will make it ubiquitous, not just across organizations, but across consumers as well. So that those consumers can benefit in their own homes, anytime, any point in time, and look at everything from range of motion to their brain and body health objectively. And I think ultimately that's going to decrease healthcare costs and increase ROI for all parties involved, again, including the patient.
Yeah, that's great. And I think more on the lines too is of some other component of how do we measure outcomes? How do we know what we're doing is valuable? In the background for the last, 10 years, they've been talking about value-based care and value-based reimbursement, and how do we gauge that? And a big component has always, that has come to the forefront, both in the literature and in practice, has been patient-driven outcome measures, patient-driven goals, all of that sort of thing. So there is a component that can be handled via telehealth or in person that is, it might be something as simple as like a quick dash or something, some kind of questionnaire that gauges a client's perception of their function and where they feel like they're at, or their real limitations as they see them or perceive them. Because when you talk about what is valuable and what is value-based care, ultimately speaking, value is subjective, right? And it's subjective on the part of the client receiving the services. So I think that's got to be a piece of how we measure outcomes as well. Because if we think it's great.
Point. Do you mind if I say something real quick? Because I think it really resonates with us. Is that we all know that there's far more variables in today that we're able to build into a model that we should be building into a model. So whether it's patient-driven outcome measures that might be considered subjective by some, but that are also still how they feel day in and day out, whether it's sleep, whether it's nutrition, there's so many variables that need to be built into this equation. Let's make sure that when we're building models and using algorithms and machine learning around the modeling that we're doing, that number one, it's not a black box. There's a lot of sophisticated people out there. They don't have to be sophisticated to utilize that, but we want to be clear and concise in regards to how we're generating scoring mechanisms, data visualization, actionable data. there's so much data being thrown at us today. It's absurd. And I think as clinicians, it's a real struggle. And I hear it day in and day out when we talk to thousands of clinicians every year, if not more, and organizations for that matter. It's frustrating. And so how do we use, though, the data we can generate even through patient surveying and combine that with objective measures, like Tony said, in regards to range of motion, or maybe measurement constructs that we generate by using Trazer, or any other number of modalities that are out there, or technologies that are out there? How do we use that? How do we aggregate the data and provide the best modeling and the best insights so we can create the most clear and concise care paths around treatment? And I know for a fact, and we've got a lot of brilliant people we're blessed to be supported by. I know for a fact that one of the struggles, for years, you can't see a lot of things with the naked eye. And when you can objectively quantify things you cannot see with the naked eye, it allows you to not just throw a bunch of different modalities to the wall for somebody with an ACL injury, but it allows you to specifically address where those real deficits lie with that patient. And I think that provides value, again, to every single stakeholder along the line, and ultimately provides a better patient outcome when you can build modeling around as many variables that are important. Again, those are important variables as you can. And so I don't know if that resonates with the group, but I think that's an important aspect of using everything from patient surveys that are far more subjective to actionable and objective measures like range of motion and kinematic outputs and such. Combining those two gives us a better model and a better way to treat patients.
Oh, exactly. It kind of moves us towards a biopsychosocial realm. Eric, what have y'all been using for outcome measures?
Yeah, so we've been using quite a few of the same things that we've been talking about. We've used patient questionnaires. We've done a lot of subjective information. We've done patient satisfaction surveys, post-case evaluations. I love the AI portion of BlueJ on the BlueJ Engage and the range of motion. We've been using Trazer. We've adopted Trazer in my practice for over 4 years now. And so the kinematics and the range of motion and the objective test data points that are there, we still use those today. It was interesting. I've seen some really creative ideas. Hand therapists, post-op patients, they were freaking out about what are my patients going to need? I can't see them in the clinic. They were literally drawing out hand drawings of goniometric measuring components. They were posting them. The patient could download it, and then they would put their hands or wrist on it. They'd look at range of motion on the backdrop of this piece of paper so that they were at least getting some variable so the patient was doing it. I've seen some unique environments where they've set up telehealth centers where a patient goes to, particularly in the workplace, like in a workplace environment. And I could send a goniometer or a pinch meter or a grip strength of some kind or some other type of test measuring tool, goniometers, and be able to have it at the station. The patient checks into a virtual appointment at that designated virtual state, and then the therapist guides them through, I need you to squeeze this grip, just a dynamometer, for instance. How do you use a dynamometer? You point the meter at the therapist on the screen, and you're reading the information off of it. So they're getting some visual objectivity through a diagnostic tool. Once we can get to an AI or an MI version of that, or even a VR and capabilities that are out there today in innovation, which is really exciting to me to where that's going to go. I think we're going to see some really cool emerging things that Tony talked about. But we're trying to do what we have always done, but uniquely place it in an environment where the patient can have access to it. I've seen partnerships with like a Myers Distributing or a PT United or a bunch of other vendors that are out there where the therapists are encouraging patients to go to sites and purchase things that are drop shipped to their homes. That gives them the environment tools that they might need in their home environment or their work environment or fitness environment, and then schedule those appointments with the therapist so that they have some tools with them to be able to measure the outcomes. But we are heavily right now kind of relying on the patient's subjective information and feedback. But I think automation and innovation is going to get us to that payment models down the road where we're truly quantifying and validating how great a care we're really delivering. And to Dan's point, there's a ton of research going on right now in AOTA, APTA, ASOT, other universities that I've had conversations with around the country. I know FAU's got a big research thing going on right now. There's lots of grant money out there. This is a big topic, and we need to be able to prove and measure our value for sure.
Yeah. And that kind of brings us, this whole conversation has kind of led us into the next series, which is kind of what you said, payment models and reimbursement structures. Currently speaking, I mean, prior to COVID, it seemed like it was hit or miss. Many people were not, CMS didn't pay for telehealth or reimburse telehealth for PT and OT and services like that. What are the current challenges? And then kind of where do you see it going? We'll talk with Daniel. Why don't you answer that? And maybe Tony, I know you've got a little bit of insight too, since you run a platform across the country here.
Sorry, the question was about reimbursement?
Reimbursement, what are the challenges?
Yeah.
That
Sure.
sort of thing.
Yeah, well, first of all, it's the unknown. That's the biggest challenge, I think, going forward. You know, at the moment, there are still people who are a little unclear about coding and modifiers and place of service. And, you know, it definitely wasn't made easy by the fact that every insurance company does things differently, and every insurance company does things differently in every state. So at least Medicare is pretty consistent across the board, you know. So when Medicare put out their regulations to allow physical therapists, occupational therapists, speech therapists to treat via telehealth, that definitely made things a lot easier for a lot of practices. It opened the door for a lot of them to provide the care. So they have their coding and billing, and you know, it is unknown. They've put out there that these regulations will be in effect till the end of the public health emergency, but none of us know when that's going to be. The other major payers have recently updated some of their coverage. So, for instance, United Healthcare is offering coverage through July for their commercial, through September for their Medicare Advantage, and they've said, you know, for Medicaid, still state specific. And a lot of the states have required that telehealth be covered as if it were in office. So it's still kind of a, you know, it's a little bit of a maze and a puzzle for an individual practitioner to keep up with everything. There's definitely people out there who keep track of these things. It's something I do. I keep it and I make it as public as possible to put the information out there and make it easy for practice owners to keep track of these things. But, you know, also as we discussed in our conversation before this call, that there are plenty of opportunities to go outside of the framework of third-party payers, and telehealth is will definitely accentuate that. It will multiply the opportunities because of the ability to reach people in other outside of your office situations, and, you know, providing the convenience of what people expect from the marketplace, from their healthcare and other things. As far as the challenges go, though, you know, it's a constant, on a regular basis. You really have to be tracking these things.
So,
Yeah.
Hey, Rafi, real quick, one of the things I've learned is that parity does not mean clarity. Just because there's parity laws and they're supposed to mimic what you do in the office, that's not necessarily it. Here's my advice to folks listening. You have to have a really great verification of benefits plan, just like you do in any other situation. If you offer functional capacity evaluations in your office, that not every payer covers it. And you have to ask the right questions. So in our practice at Motion PT, we went through a significant, very structured, bullet point by bullet point. Here are the things you need to ask when you're on a call with an insurance payer. You need to even use certain terms: telehealth, telerehab, telemedicine, because every policy is a little bit different and every payer is a little bit different. So have a plan, stick to it, ask the questions, take the time, ask them consistently, make sure you know what you're asking for, and that you keep asking for it. And if you get approval, write it down. Keep track of who gave it to you. Keep track of when you talk to them. Make sure that's documented. Legislation is going to be critical going forward. Make sure that you're part of your state and national associations where you have lobbyists that can speak on your behalf and try to go get these things covered. That's going to be a big part of it going forward. And then there's certainly the concierge medicine approach, which I love very much. And that is, let the consumer be responsible for the costs of their care that they were willing to pay for and they see value in. But here's the thing to therapists on the call: up your game. If you're going to build a practice around a consumer paying you directly for your service quality, make it valuable, make it unique, make it skillful, make it purposeful, and give them a great experience, because you've changed the environment in which you're offering it. You make that environment awesome as well, and then those folks will pay for it, and they'll see value in it, and make sure you're following up with them.
I agree with Eric that the concierge cash-based payment can be a good supplemental option for therapists to generate revenues. For example, Blue Jay helps companies to build a telehealth scheduler on people's website, on the clinic's website. Certain clinics opt to charge cash for certain consultations, and we take the payment, and then we deposit the money to the clinic's account. This way, then the clinic can build certain programs. It can be a consultation, concierge consultation, or can be a month-long follow-up program, and so on. So we build these tools in the platform so that the providers have the option of taking cash from these services, telehealth services. So I think that's that can be a great option for a lot of clinics to consider.
Yeah, I think that beautifully ties into the next segment here, which is, for a very, very long time, healthcare in general, in the US anyways, has been very focused on treating the problems. We haven't been reimbursing for wellness, for proactive healthcare, it seems like. And at least from my standpoint, what I see with some of my clients and with research is that the opportunities exist, and it exists leveraging telehealth and technology to really move into that space of let's put aside, you've got an injury and we got to rehabilitate you, but what are the options for, health promotion, health wellness, that sort of thing, concierge health? I know, Daniel, you've got some thoughts on this. What are some of the opportunities for telehealth to be integrated into a practice more so than what we're doing now? Like what are the possibilities?
Well, the possibilities are endless.
Yes.
Tony, they really are. I mean, Tony
Yeah.
talked about industrial rehab, and being in the workplace. There's, of course, senior care, where one thing I love in senior care, or other areas, is group sessions with telehealth. So, for instance, if you have if you treat a lot of patients with Parkinson's, or you treat a lot of patients with chronic pain, you could do a weekly or a bi-weekly group session, which is paid for by most payers, including Medicare, where you have 10 patients on a call, essentially, and a PT or an OT leads the session for 30 minutes or 40 minutes. And, now you've created a community also for people who are managing the same sort of, and a lot of practices have done this in the practice, but that's always a challenge. It's a challenge to get people there. It's so much, it really lends it, like telehealth really lends itself to that kind of opportunity. And of course, I like subscription services where you can do, whether it's through wellness, whether it's considered wellness or PT, you combine an in-office visit and a remote visit on a weekly basis, charge a monthly fee for that, and provide a lot of content for a particular demographic or a particular group of patients who have some sort of condition or dysfunction. And I think that we're going to see a lot more of that. And I don't know that third-party payers will reimburse for that, but I think that a lot of practices will establish, and as Eric said, pick up their game to the point where it's going to be a huge value to people. Think of someone, I mean, a lot of insurance policies have deductibles of $2,000, $5,000, $10,000 a year, right? So you're spending money on, in contrast to what some of these ideas of we have to up our game for out of pocket. I mean, everything's out of pocket to a lot of people, really,
Sure.
right? So, I mean, you really have to be providing value, and there's certainly portions of the population that are really interested in their musculoskeletal health, their functional ability. It's everything to them. So they will pay for a subscription service, or they will pay for wellness type, wellness. It's care. It's care all the way.
Hey, Rafi, there was a question about from the audience regarding Medicare and the ability to pay cash. Okay, sorry. So we use an ABN, and that's been a recommended approach, and every compliance officer has a different opinion. But if it's not a covered service, right? Typically, wellness is not a covered service in an insurance plan, and ABN, I think, helps satisfy that from a Medicare perspective. And if services are not, if the services have already been covered and you're outside of your service plan and those services aren't available, it doesn't mean that the care shouldn't be delivered. And so if a customer or consumer has an opportunity to take advantage of it, I think they should be able to pay privately, particularly from a provider who's not necessarily going through a Medicare reimbursement if they're not credentialed with them, those such things. That's my non-compliance answer.
Yeah, I think that's important for sure. Eric, in your space, where do you see telehealth building into your practices? What are the opportunities there?
Man, I think to Dan's point earlier, it's just an endless opportunity, right? I loved, Dan had talked a little bit about things that I've talked about on our wellness team is these virtual wellness activities. Every senior living community has a requirement of so many hours a week of activity, particularly in a concern of who comes and goes in your community. If you think about a community, there are hundreds of people who live in a giant house. And if you live in your own home, how many people do you like to come to your door every day and walk through it and come and walk? How many people walk around your house? Like they go in your kitchen, they go in your bathrooms, they go in your laundry room. Like that's a senior living environment. So if we could mitigate the traffic from a security perspective, a safety perspective, a wellness perspective, and still be able to deliver quality care services to a senior population that needs clinical oversight and clinical guidance, and we can do it from a virtual platform, big TV on the wall, through a Trazer platform as an option, through a virtual Blue Jay, whatever that technology is, and have a licensed practitioner, athletic trainer, exercise physiologist, PT, OT, speech therapist, whatever, be able to deliver a core group of wellness services, whether it's nutritional, whether it's exercise, whether it's supplements, whether it's brain health, whether it's whatever, spiritual components. There's 7 or 8 components of wellness and mind body components in the dimensions of wellness. And if we can do it through a virtual platform and literally every resident has the opportunity to take advantage of it, regardless of reimbursement, regardless of barriers to access to information, if we could capture healthcare sooner and reduce the need for intervention on the back end, we resolved function, we've independence, quality of life, and cost of delivery of services. And if we can improve quality of that delivery, we've hit a home run in my mind on the, as a and using this as a connected platform to deliver those services.
Yeah, no, I totally agree. Proactive is better than reactive, right?
Absolutely. Yeah.
All right. Tony, from your standpoint, where do you see telehealth?
Well,
the opportunity here.
Another layer of telehealth in terms of the providing values to to healthcare in general. That is at the preventive side. That is at the screening, assessment, triage side. So I think for self-insured employers, the employee health, for workers' compensation, for a lot of areas, it actually makes sense to have to put therapists at the forefront, at the front line to assess people, to triage a musculoskeletal condition before that employee or that consumer get directed to primary care physicians, to pain clinics or surgeons. So that way, it will improve the cost structure of healthcare, and it will be equally, if not more effective, to treat musculoskeletal health. And I think a number of payers are considering such a direction. We are working with some of our clients to help them assess such a workflow. So I think telehealth will play a much larger role than what we think now. Oh, it's social distancing, less people, fewer people come to my clinic, maybe I should do telehealth. It's way more than that. It's probably will help our clinics to grow in the areas that you will not imagine, that you have not imagined before, such as working with a payer and together to be the frontline triage provider, and so on. So that's something I want to add and give people some ideas to think about.
Yeah, great. I know we've got a couple questions here. Eric, do you want to handle the one about the future of therapist-controlled session with Trazer?
Sure, absolutely. Hey, Dr. Pandya, glad you could be on today. I've had a unique opportunity to consult with and collaborate with Trazer over the last several years. And this is a great opportunity to be able to deploy this technology to a residential environment where it hasn't otherwise necessarily been. I've had a personal experience. My daughter, full disclaimer, is a U.S. Olympic Taekwondo athlete. And she has a Trazer device in our home, in our basement, in our training center. And she's been able to train on Trazer when she can't otherwise go to a competition or go be with her team, and she can't go anywhere right now. And so I know that Trazer's been doing this with a Major League Baseball player as well. But the ability to tech platform virtually go right in and do the triage, to Tony's perspective, to be able to triage with her, or to have her coach look in on her training, to be able to give her advice and look at her mechanics and look at her technique and her form. This is a great opportunity for a practitioner. It's an awesome opportunity for a consumer. Dan's in this New York market. You know how hard it is for transportation to get into some of these locations? And do you know what the arrival rate or cancellation rate is in some of these markets? Because you just simply can't get there. It's just a complex issue. If you can improve the frequency and duration of patient visits by giving them a convenient opportunity and a Trazer as an option, and you have so many other mechanical components to it, I think that's a great opportunity. And I think 30% is a low number when you start looking at residential and consumer-driven models.
Yeah, that's great. We got a question from Phyllis who wants all of our contact information.
Hey, Phyllis, I'm on LinkedIn. I know Tony's on LinkedIn. Dan's on LinkedIn.
Yep. Daniel Seidler on LinkedIn.
Yeah, Eric DeYoung. You can reach me on LinkedIn all day long. Happy to connect with you.
Yep, I'm on LinkedIn too, Rafael Salazar II. So.
I just want to say real quick, Rafael, you and I have been trying to work together for years, buddy. If this is how we do it, I think this is the way it was meant to be. I love it. You've done a great job today, Rafi. Really.
Thanks,
great
man.
job.
Yeah, thank you, Rafi. It's like a pivot, a new thing for you, right?
Yeah, I'm going to be a host now.
Yeah, dude, you're good at it. I mean, first shot, not bad.
All right. Well, I think that's pretty much the time we've got. We want to thank Trazer for sponsoring this conversation. Barry, is there anything you want to say to close us out?
Yeah. No, number one is just thank you to all of our panelists and thank you all for this incredible insight. I think that there's a lot of value added. Hopefully the group on the call feels the same way. Thank you all for being here and taking the time out of your valuable, out of your day and your valuable time to be here. So, I think this is fantastic. We'll likely have a follow-up to this conversation. I know there was 1 or 2 questions in regards to reimbursement. We can address those in the next educational webinar that we have in regards to this topic. I know it's a big topic, but we'd like to do another round or another session on this front. But again, first and foremost, thank you to the panelists. Thank you for all being here and taking your valuable time. We appreciate you all. And again, thanks again for everybody, just being engaged. Let's work together to continue to progress things forward. So thanks, Rafi, Tony, Daniel, Eric. You guys are awesome. This is fantastic.
Thank you guys for putting it together.
Yeah, thanks for putting it together. Yeah.
And then I want to specifically note, Craig Waters, who had a big piece in pulling this all together.
Yes, the man behind the curtain.
Yeah, exactly. And so he doesn't get enough recognition. But Craig, thank you.
Well, thanks, guys.
To everyone.
Hey, just one last point. It's not regarding this webinar, but I do think, having another recap of where we're at with telehealth, potentially, 3-4 weeks from now, because it's changing so fast, might not be bad. But next week, we're going to have 4 pretty renowned athletic trainers and sports medicine guys on, along with somebody that was a professional baseball player and now represents some players. So we're going to be talking a lot about return to sport and some of the issues around that and COVID and some of those aspects. So it should be pretty interesting next week on Thursday at the same time. So
thanks, Craig.
Awesome.
All right. Thanks, everyone. You guys are the best.
Thanks, everybody.
All right. Thank you,
Yep.
everybody.
Take care, panel. Take care, group.
Bye.
Take care. Thank you.